Seeing it often, you get somebody sitting here telling you need to blow by blow what's going on.
Yeah.
I'll sit here and I'll disrupt it for you.
Cool.
So in the first eye or the second eye?
The second.
The second eye, okay.
What are the dots on the eyes for?
Actually, it's an old surgery standby in case the flap were to completely dislodge. It's important that it's oriented the same way, not just put in place. By having those two different lots in different places, you can line those right back up. So.
And the flapper's the thing that they just pull off the eye. That
right.
Thing
So
that
it's creating a flap right now. There's a little motor sitting on there, and as it cuts across, it cuts like this. So even though it only moves a quarter of the way, you think of my hand being as it cuts like that, it cuts all the way through, and it just leaves a little hinge. So as soon as you get that locked in there, it's a little bit not quite in yet. So let's catch the top of her eyelid right there. You can see. Not always. It doesn't. It's not a one size fits all kind of thing.
And he can see all this happening?
He's actually looking through a microscope that is exactly this view.
That's cool.
He's seeing exactly this. You see it got a little scapula is put down there and grabbing a little spatula up top there to pull that eyelid out of the way. Now it's on track and it's moving across.
Wow.
Let's see if it nicked her eyelid, which is very common with people with small eyelids. It's and that just created the flap as it went through there. Pull the full thing off all at once.
Wow.
And I'll just line it up here. I'll go underneath there and just lift that flap up, pull it back. Smooth as can be.
Wow.
That hinge is actually the top of her head. That's where that hinge is. So when she blinks every day, it's going to pull it back down over.
Oh, okay.
And you see how things have kind of texture, kind of an orange peel texture underneath there. That's just the stroma level of the cornea. It looks like that all the way through.
Wow.
So it just dries it off because the laser can reflect off of wet surfaces. So I'll take a couple of waxes here and just get it really nice and dry. Now it's doing iris registration and saying pupils right on line, and this is saying this is not only your eye, this is your left eye, so they can't mistreat the wrong person in the wrong eye. It's just like biometric identification.
And that's the laser thing right there?
That is the targeting iris registration. And the laser's coming up right here. You'll see light blue. See the blue? That is actually the laser.
Oh, wow.
It's flattening out the cornea. You'll see as it gets across this edge here, and you see it's ablating that tissue and flattening that out as it goes.
Wow.
And now it goes in that random pattern because actually as it ablates the tissue, you see it moving around, those vapors actually come off and it can refract off those vapors. And so it goes in a pattern around those, lets the vapors come out of the way, and that's it. And that is the entire treatment right there. So he'll wash this out and irrigate it. And really, one of the nifty things about your cornea is that it does not have any veins in it, no food storage system or carrier system because you can't see through them. So your tears actually have fluid in them that feeds those cells. There's a layer of cells on the bottom of the cornea called Bowman's layer, the Bowman secreting layer, that actually pulls your tears through your cornea. Well, that creates suction. So when he lays this flap back down, you'll see it in just a second. You can see the edge right there across there. It'll literally just and suck down. And if he would have to, he'll look at it in the slit lamp here and have a look. And if he sees a piece of lint or something underneath the cornea and he goes to lift it up, you'll see him under it to lift it back up. Yeah. And that's just one angry eye right there, isn't it? I'm actually in her chair, so. Susie.
Cool, thank you.
Mandy called about the plastic submission last time.